Pancreatic cancer has a higher mortality rate than other cancers. It is because pancreatic cancer is difficult to detect in its early stages. In many cases, it progresses to a stage where resection is difficult or impossible by the time of diagnosis. Therefore, the treatment of pancreatic cancer relies heavily on chemotherapy with anticancer drugs. However, the use of anticancer drugs is associated with problems such as the emergence of resistant cancer cells and severe side effects. So, the establishment of new pancreatic cancer treatments is always desired. Ferroptosis is attracting attention as a new strategy for cancer treatment. Ferroptosis is one of the programs that lead to cell death. Although apoptosis is well known as a program of cell death, ferroptosis and apoptosis are different types of cell death. Ferroptosis is characterized by an increase in reactive oxygen species dependent on intracellular ion metabolism, resulting in the accumulation of damaged lipids, which ultimately leads to cell death through the destruction of cell membranes and intracellular organelles. If we find a new way to induce ferroptosis in cancer cells, we can use it as a new chemotherapy. A research group at Tohoku University Graduate School of Medicine, led by Dr. Yoshiteru Kagawa and undergraduate student Akane Suda, discovered that the polyunsaturated fatty acids linoleic acid and α-linolenic acid induce ferroptosis in pancreatic cancer cells and inhibit cancer growth. Fatty acids were added to pancreatic cancer-derived cell cultures. Cells were then counted daily to determine which fatty acids had an effect on cell proliferation. 2 cell types were tested here, and in both cell types, oleic acid and stearic acid had no effect and cell numbers continued to increase for 4 days after administration. On the other hand, cell numbers began to decrease after treatment with linoleic acid and α-linolenic acid. This is a time-lapse microscopic imaging of cells after administration of the fatty acid. Here and there, cells can be seen to swell round and finally burst. The administration of linoleic acid and linolenic acid induced ferroptosis in pancreatic cancer cells. Will this effect also be seen in pancreatic cancer cells that are resistant to anticancer drugs? Gemcitabine is one of the most commonly used anticancer drugs in the treatment of pancreatic cancer. The effects of linoleic acid and linolenic acid were therefore investigated using pancreatic cancer cells resistant to gemcitabine. The cell types were used. PK1 and PK9 are cells that are sensitive to gemcitabine, and RPK1 and RPK9, emerging from PK1 and PK9, are cells that acquired gemcitabine resistance. Both linoleic acid and α-linolenic acid induced ferroptosis in gemcitabine-resistant cells. However, there was a difference. Both fatty acids were effective in cells before the acquisition of resistance, but only one of them was effective in resistant cells. The reason for this difference is so far unknown. Still, it may be that the cells have altered properties related to lipid metabolism in acquiring resistance to the anticancer drug. Furthermore, intraperitoneal administration of linoleic acid and α-linolenic acid inhibited the growth of tumours in the mouse subcutis and significantly improved the survival rate of mice. In the treatment of pancreatic cancer, which is difficult to treat surgically, the effectiveness of chemotherapy is significant. In order to achieve optimal treatment for each individual with various different conditions, it is necessary to increase the number of effective chemotherapy options. We must then take into account not only the effectiveness, but also the risks, such as side effects. Linoleic acid and α-linolenic acid are essential fatty acids, which we obtain from our daily diet. Although these results are still at an early stage and further validation is needed to determine whether they are actually effective in the treatment of human pancreatic cancer. This finding is expected to lead to new pancreatic cancer treatments with significant advantages in terms of cost and side effects, as well as in terms of increased options.